thank you everyone for being here today on a cloudy, sunny, cold Friday, but we are delighted to be having this conversation. On Zoom, we have Cristina Kahlo, co-curator of the exhibition, artist, photographer, renowned artist and photographer herself in Mexico, and also the curator for a lot of Frida Kahlo exhibitions that have been generated by, let's say, the Mexican government as official representation of Mexican culture abroad, right? So Cristina has curated exhibitions in Vienna, in Europe, at the bequest on many occasions of the Mexican government. So clearly like an expert in the field, professionally and emotionally, Cristina. Personally, I will say, as we know that yes. Cristina is a great-grandniece of Frida Kahlo, and a lot of the materials and information that we have in this exhibition here today are because Cristina was able to gather these primary sources through her family lineage. And so thank you, Cristina. And Cristina and I are, and my name is Monica Rez-Montagut. I'm the director of the Parish Art Museum, and I worked with Cristina on this exhibition. And we are delighted to be able to have a conversation on healthcare, health science, maybe, patient health worker relationships with Dr. Maki. But first, I also want to acknowledge our sponsors for this Friday night events. So we would like to thank Weill Cornell Medicine in Southampton. And Bob Maki, you have an academic degree from Weill Cornell. So thank you, Weill Cornell and Southampton, the Corcoran Group, and the Corcoran Group for their support of these events, and they make them possible. And so Bob Maki is, his name is Robert Maki, but we've known each other for 20 years or more, so I call him Bob Maki. So apologies if you know,
not at all.
It's very familiar. And he was kind enough to interpret the clinical files for us. He's a practitioner doctor. He sees patients all the time, and we needed this expertise to help us look at these files, which are, several decades old, and try to see what information could we gather from that. So let me just read a little bit of Dr. Robert Maki. He's a professor of medicine at Memorial Sloan Kettering Cancer Center / Weill Cornell Medical College in New York, and an adjunct professor of medicine at the University of Pennsylvania. He is an internationally recognized key opinion leader in cancer research and has particular interest in sarcomas, cancers of bone and soft tissue, with impact on patients of all ages from infancy to elderly populations. Robert Maki has been the principal investigator of multiple clinical and translational studies in sarcoma and is familiar with orthopedic surgery and its complications. He is the author of more than 200 publications on sarcoma biology and therapeutics, in addition to being the co-curator of a widely used textbook on sarcoma. He is an associate editor of the Journal of Clinical Oncology and the sarcoma content of Up to Date, and is a past chair of the Medical Oncology Examination Committee of the American Board of Internal Medicine. He continues to participate actively in training the next generation of clinical leaders in cancer care, and having been on faculty for many iterations of international cancer research workshops for junior oncologists. So thank you, Baki, not only for being with us today, but also for the labor that you do in the healthcare profession and building up our next generation.
Thank you, Monica. It's a great pleasure to be here. Thank you for the invitation. And great to meet Cristina.
So, Cristina, I think now I would like to...
Nice to meet you also, Robert.
Thank you, Cristina. I would actually like to pass the virtual microphone to you so that you can give us a little bit of context, of why we decided to engage in this exhibition that focuses a lot on Frida Kahlo's health journey and her chronic pain, and how you were able to have access to a lot of this information, and why this perspective is important to you. And then we will go back to Robert Maki to see, what he can tell us about the clinical files and the particularities of the healthcare profession. Does that sound good?
Yes, thank you, Monica, and thank you to everybody for joining us today in this conversation. Well, this exhibition took a long time to make the whole idea, because some years ago, about 6 years ago, I was able to see the files, the medical files of Frida Kahlo at the hospital, because they keep the files in microfilm, and because of one doctor who is a friend of mine and that used to work at the ABC hospital, the Centro Médico ABC, as it is known in Mexico. She told me that these files were still there at the hospital. So I had to make a long line of things to prove that I was related to Frida Kahlo, because it's not that you can go to the hospital and ask for anybody's files like that, no? So I have to prove that I'm related to Frida, so I have to took my ID and my birth paper and a lot of things. So they give me the chance to see these files. And it was really emotional to see them, and for the people who work at the hospital also was very emotional to have someone related to Frida Kahlo that is interested in these files. So the first thing that I did was making photographs. As a photographer that I am, I made some photographs of these files, but with whole TV, because these files, as they are in microfilm, you can see them only in a kind of TV, like an old TV. So I like that very much, as an not only the file but the whole thing, the complete thing, to see. So I took the photographs, not cropping the file, but taking the photograph of this pantalla. How do you say pantalla? Sorry with my
Screen.
English. Pero
No problem. The whole
screen.
photo of the monitor and the screen.
The monitor, exactly. And because I want to share with you, with the people who go and visit the exhibition, to see the files the same way I did. It's like sharing my personal experience looking at them. So that's why I wanted to make these light boxes to show the same, that you have the same sensation of the light and of the TV and so. And so the second step was, what can I do with this? Because it's something that I want to share, that it's not been seen at that moment. And so I start looking for photographs of the hospital. So I find some photographs of the hospital where it was in that moment when Frida Kahlo was being operated. Not the actual hospital, but the real hospital, which you can see here, those images. And I found them very, very interesting. Not only because Frida Kahlo was there, but also, and here we have a doctor with us, and I think that they are part of the story of medicine in Mexico and wherever. For example, if you can stop in this image, we can see that there are some windows, no, in an operating room, something that could be impossible these days. Also, there are some photographs of Frida Kahlo after the surgery, where she's lying on the hospital bed and she's smoking at the hospital. Today, it's impossible to smoke in a hospital, and worse if you have been if you had a surgery yourself. So I start to link all these stories: the files, the hospital, and then the photographs of Frida Kahlo, which are many photographs. I think she's one of the artists that has been much more photographed by different artists and photographers and journalists, and because of his particular personality. So there are many photographs of Frida at the hospital, but also we include in the exhibition photographs of the people she loved. For example, Diego Rivera, of course, first of all, then the family, and then the doctors, because there is a notebook of Frida Kahlo called the Diary of Frida Kahlo, where she writes ideas and so. And in this little notebook, she writes many times, "I'm thankful to Dr. Leo Loeser, to Dr. Juan Faril, to the nurses, to the people of the hospital." And one thing that we have been talking, Monica and I, is that if any one of you had sometime a surgery, when you get into the operating room and you take the hand of the doctor, it's like you know that your life is in the doctor's hand. So it's a kind of thankfulness from everybody to the doctors, and more these days of the last pandemic and so on. And also, I think that Frida will be pleased that we made this for her.
Thank you so much, Cristina. One comment that information you've shared with me is a special appreciation that Frida Kahlo had for Dr. O'Farrill, who we see here. He was a very famous doctor in Mexico, prominent doctor. Frida had some of the best care available in Mexico at the time, including under the care of Dr. O'Farrill. But she had special appreciation for Dr. O'Farrill because he walked with a cane and had chronic pain as her. And at some point she said, I want to be Dr. O'Farrill's doctor because he will have a certain empathy and compassion for me like no other person. Like, he understands chronic pain. And so she painted, we have some photos where she painted the portrait of Dr. O'Farrill, but she also painted her painting a portrait of Dr. O'Farrill with a palette, and you call this on the exhibition, the palette where she has the oil paintings is in the shape of the heart, right? Where she puts the colors from which the brushes picks up the paint, it's in the shape of a heart. So it was kind of an homage in appreciation to this compassion and empathy that she had for all her doctors, but in particular as well with Dr. O'Farrill, correct? Is that a fair assessment, Cristina?
Yes, and I will include Dr. Leo Eloeser, from whom she also painted a portrait. And even that Dr. Leo Eloeser was not all the time the direct doctor, as it was Dr. Juan Faril. Frida used to write a lot of letters that we have also in the exhibition, asking to Dr. Leo Eloeser what he thinks about the other doctors' opinions. And also she write to Leo Eloeser asking or telling him about her problems with Diego Rivera and ideas about politics and art.
Yes, and on that note, I want to turn it to Dr. Robert Mackey and ask, was this a particular relationship that Frida had, Cristina, 32 surgeries in her 47-year lifespan? Yeah. And then we argue in the exhibition that we know that she wanted to study medicine, that she studied anatomy, and that ironically she did spend a lot of her life in the hospital. But is this unique to Frida's situation where she had so much health issues that she developed this relationship with her doctors? Was this another time? Is this still possible today? Can you share your insights on the profession today, if you can?
Well, I mean, it was a different time then. At that time, at least here in the U.S., there were things called house calls, right, where the doctor would actually come visit the patient at home. There's actually more of that is happening now with teams of healthcare providers, especially for elderly patients. It's a lot easier and more appropriate to take care of them where they're living as opposed to dragging them into the hospital where they get disoriented and, all kinds of bad things can happen, infections and things along those lines. But it was, entirely a different time where there was more time in between patients to visit them. The stays in the hospital were much longer. You'll see the documentation from her stay that's in the exhibition. It's 3 months. Who stays in the hospital for 3 months these days unless there's a real problem? Mm-hmm. And she did a lot of her recuperation there. But she started out from a very bad place. I mean, she had polio when she was, I think, 6 years old. Is that correct, Cristina?
Is what? Excuse me?
She had polio at age 6, I believe.
Yes. So that at that moment is when all the physical problems of Frida started. She had, because of the polio, one of her legs was more thin. And so we have also the drawing at the exhibition, which is called The Appearance is Lie. And you can see that one of the legs is thinner than the other.
Right, and one has butterflies drawn on them, and the other one doesn't. Right.
And the leg that had polio, if I remember right, is the right leg. It's the same one that was fractured so badly when she had that terrible collision between the tram and the bus that she was riding, where basically a handle from the bus went right through her, back and down in between her legs, basically, right out of her pelvis. So it shattered her pelvis. She ended up with at least 3 spinal fractures, and they found 3 more later. That same leg that had polio had 11 fractures in it, and anybody even today would have a really hard time recovering from that. One of the biggest issues is called osteomyelitis, infection of the bone, and when you have a dirty instrument or something causing this wound, it's the infection gets in and basically sticks to the bone and doesn't come out. Yes, she did receive antibiotics, but there are descriptions in the records, even here, of trying to open up an area, infection comes out, and so she was chronically, not just from the pain from the repositioning and healing problems that she had from all the multiple fractures, but also what seems to be the osteomyelitis as well, infection, which may have led to those sequential amputations eventually of her right leg. So, I mean, she had that the bus accident at age 18 and then died at 47. From the age of 6 forward, she had an incredibly difficult life, which I really didn't appreciate until I had a chance to review those records. It was incredibly enlightening.
And I think, Bob Maggie, perhaps you went through the same journey as I did, where after you have access to her medical, a little bit of a window into her medical history and what it really meant, we saw the hospital and the technology under which she was having some of these massive surgeries, and there is no way back. There's a different way to see Frida. Saturated with compassion and empathy, and a different way of understanding her art and her need to express some of this pain, some of these thoughts through her art. Did you go through something like that? Do you see her differently now than you did before you reviewed her clinical files?
Absolutely. I mean, and you can understand how she needed to, number one, pass the time, and how her understanding of anatomy, she, like you mentioned, wanted to go to medical school, how that may have come out in her art as well. They do, I think there were a couple of photographs of her in a courtyard of the hospital, the ABC hospital, which is still there, actually. And it was just interesting to see because you can see in the orders that were written for her, she's getting her antibiotics. Interestingly, very little in terms of pain medication because she had that morphine allergy. Yeah.
I mean, that was eye-opening. The fact that to see in those clinical files, it is in one of the letters written by her older half-sister when she's taking care of Frida, when she had a vertebra fusion surgery that was infected, and she's describing this infection. It's a tough letter. She's describing this infection to one of the doctors, saying, is Frida going to survive this? Because she's allergic to morphine, and she really can take very limited painkillers, and she actually had to go into a second vertebra fusion surgery, and she actually passed away a few months after that second one. Correct, Cristina?
Yes, and the big problem was that she has an infection, and they put the corset on the surgery on her body. So can you imagine the corset with an infection in the spine? And in that letter, written by Matilde, she says that she stinks like a dog. Something like that.
Smells.
An expression like that.
Yeah.
Because the infection was hurting, and at the same time it smells. So they have to open again this corset and make a surgery again, and then put again a corset. So it was like a very, very painful surgery and story.
But Maki, thank you, Cristina. From the files that you helped us interpret, can you give us a little bit of like what we have in the exhibition? Because you went one by one, and she went into the hospital for gangrene. I'm sorry, but we will get to other parts of the exhibition. But I do want to get through the expertise. She went into the hospital because she had gangrene on her right foot. And I remember looking at the files and asking you, why is she having for breakfast orange juice with 3 spoons of sugar and then insulin, and then you share some thoughts with me.
The insulin, for example, even though you're not diabetic, there was thinking at one point that insulin is actually a growth factor. It helps things heal. So the idea was to try and promote bone and soft tissue healing by giving the insulin. But to prevent, when you give insulin, your blood sugar drops automatically, so you have to protect against it. That's why they gave her the orange juice to kind of the reverse of what we do now. And we give insulin to diabetics, and then you may occasionally have to take some sugar or whatever if your numbers drop significantly. Here they were giving the insulin first. Because
she had bad circulation, right? Because she came in with gangrene, and they were trying to
do everything they could to help the tissues heal.
And she was under observation. What we have in the exhibition shows that she was under observation for a couple of weeks.
It's a total of, I want to say, it was 3 months of records there. The first month was the most acute portion overall, and it eventually led to these sequential amputations of the right foot and then the right leg.
Yeah, I have to share that with you all. We do have in the exhibition the file, and I'll find it, that says today is the amputation of the third of the right leg. But I just learned today through a casual conversation between Cristina and Dr. Mackey, that there were several amputations, that they were going up her right leg, correct?
Yeah, I think there were at least 2, one for the foot, and then they had to go higher up because the tissue was just dead and or still infected. So you have to go above the level of the infection to try and get that to heal properly. And this is that same leg that had 11 fractures.
Correct.
So it was already structurally abnormal, and maybe there was more than one area that was infected, in fact.
And then the files that we have in the exhibition show how she had a little fever after she was also, I believe about after 2 months of having had this surgery, she was able to go outside to the patio. So finally she was able to go outside, and it was to that patio that we see of this hospital, right? So when it's like, yes, you can go outside, it's not really out to the supermarket or to do, run some errands. It was still in a very contained and isolated environment. Correct?
That's exactly right, and you're under observation. That's what we did back in that era. So people were watched for a long time. A lot of the charts show pretty boring-looking vital signs. The blood pressure and the temperature and the heart rate; those are all pretty normal. I thought some of the most instructive information there came from the doctor's orders, where you saw what she was receiving over what period of time as well.
So those files, Cristina, jump in, because I'm like fascinated with this. So.
Yeah, no, I'm fascinated.
Okay. So looking at those files today, from where the profession is, what strikes you as different and what strikes you as still the same? And in terms of why Frida would have this need to then convey some of this in her art. Like, let's not forget that ultimately we want to talk about her art. Yeah.
Absolutely. And a lot of the things are the same. For example, if you have a fracture of your leg, they may put your leg in traction for a period of time, as she had to experience, no question. And also osteomyelitis, this infection of the bone, it's still a big problem. People have to be on chronic antibiotics. Our antibiotics are better than they were in the 1950s, where we had sulfa and penicillin, and that's about it. Here we've got a much more widespread palate antibiotics to choose from as well. But she was on those, and we still treat osteomyelitis in a very similar fashion. Fortunately, with newer techniques, you're able to put a rod down the bone. Mind you, also in the 1950s, there was no such thing as a CAT scanner. We only had X-rays. The first CAT scans came about in the mid-1970s. So all you had were X-rays, and if you wanted to know what's really going on in the tissue, you had to take somebody to the operating room and open things up. If you suspected an infection, we didn't have a test other than seeing the pus come out, of knowing what was really going on. So sometimes you just had to do an exploratory operation. Now with new scanning technologies from the 1970s and 80s, CAT scans, MRI, PET scans, other things along those for those sorts of techniques, we can do a lot more without ever having to touch a person and invasively. And that's one of the massive changes that's happened over these past 50 years at least, not even going back 70 to her time.
Two questions from me, and then I would like Cristina to share some thoughts. One is that this allergy to morphine, were there other options to mitigate her pain, or that was her life?
There weren't really great other options. I mean, you have different forms of opium, basically, but all of them had morphine in them. Laudanum is the classic one, which is about a 1% solution of opium poppy extract. And that was a really nasty drug because we talk about narcotics. There's narcotine in opium, which is the stuff that actually causes nausea and vomiting. And the other parts of the opium poppy actually give you the pain relief, the morphine and others, codeine, for example, that also comes from an opium poppy. Those are the useful medications that come from there, but it's tainted in essence by some of these other compounds that are part of that extract, basically. And it makes you think, well, was her reaction just to the nausea and vomiting producing portion of the extract?
I see. And then one of the photos that we have show that after her leg amputation, there was like a little kind of like tent done around the leg that she then turned into like a puppet theater that she was actually playing with her other foot. Are those tents still done today? What was the purpose of that tent? And no, there's no...
I really don't know.
Okay.
Unless it's to help prevent infection of a wound that's open. That would be my guess, but...
none of that happens today, those little tents. Okay.
But although we do have, we'll have positive and negative pressure rooms where we prevent air from going in or going out. That's sort of the equivalent of what we have today. We'll use that for patients undergoing bone marrow transplantation, or where they're, we're worried about they're being immunocompromised and you don't want to expose them to anything. So we do have something similar, but it affects the whole room.
But Maki, smoking in the hospital, when was that like banned?
I would say it was probably the 60s or 70s for some places, not until much later on, even 2000s. For other places, it depends on where you were. I mean, there were those old ads from magazines in the 1950s where the physicians are also smoking. Oh, the burning sensation in your throat is good for you. It's cleaning things up, right? So it was much more accepted for the physicians and patients to smoke together even sometimes.
Oh, interesting, like bonding. So talking about bonding with your healthcare provider, but Maggie, so have you ever given political advice, right? Help fundraise, like at some point in one of the letters, Frida is asking her doctor to help her fundraise for the anarchist cause in Spain. She's also asking one of the doctors to please make a hotel reservation for her because she's going to an art exhibition opening. She's asking, and this is very telling, that she's asking one of her doctors to actually mail her easel, her special easel, back to her or to another hospital so that she can continue painting in the hospital. So my question to you, is that possible today, that kind of relationship? I gather not, but
it's unusual. I guess if friends of the family, that sort of thing might happen, but otherwise that would be quite exceptional, I would think. We do refer patients to each other. If you move cities, we certainly have colleagues in different places and try and make connections for people that way if they move. So that much wouldn't be terribly surprising.
Thank you, Bob Maki. Cristina, do you...
Monica,
yes.
Yeah, I'm sorry. Do we have some images of Frida at the hospital here?
We do. They're at the end of the roster.
Because one thing that was saying Robert, which is really interesting for the people here today, is that it's a fact that she spent a lot of time at the hospital. So in these photographs that we have at the exhibition, we can see how she has a lot of things around, and that's not possible if you stay for 2 days or here, for example. That's Frida at the hospital painting this portrait of the family. It's the family, and we can see that she has around the cigarettes, the many books, and on the walls there are another images where you can see how she put photographs on the walls here, for example, and pencils and everything. So she started to make the room with her personality, with her own personality, putting her own things in there. And that's because she spent so much time at the hospital that you cannot read 20 books in 3 days. That's because she stays for weeks. And also in this exhibition, what you can see is that there are some images of the gowns of Frida Kahlo, the ones that she used at the hospital, and we can imagine that when she was painting, then she cleaned the brush in the gown. So there is kind of a palette of Frida's colors used at the hospital. That's something interesting because the hospital gown was, as well as the outfits that everybody knows from Oaxaca and Chiapas and Mexican traditional outfits. Also, the hospital gowns were part of her outfits during months. No, so I think that this exhibition is very complete in many different aspects that we can make a research on medical things, as a operating rooms, as a medicines that she took, also the paintings that she did during the stays at the hospital. And that takes us to know that she was always creating. Even if she was in the hospital, she was painting. And I think that for Frida Kahlo, painting was also healing for her personal problems. It's a way of heal the spirit.
And on that note, thank you, Cristina. What are the ways that in this case, we could argue, we could speculate, but we could certainly see evidence of Frida using art as a vehicle for healing. In your experience, Bob Mackie, what are other tools that you see in patients? I mean, have you ever seen anyone come in with their special easel and paint? Or what are other ways that we as humans can overcome, some of these? What have you experienced from?
I mean, we actually do this all the time. And the best description of this, our best example that I'd say presently is at pediatric hospitals, where we do have art therapy, we have music therapy, Reiki, light touch, massage, those sorts of things. All of those are, part of the more holistic approach to medicine, especially if you have a chronic condition. What if you're, a pediatric patient in hospital for, a month for leukemia treatment? You need those contacts. You need schooling. So there you get your education in the hospital. You get these other, I don't want to call it bells and whistles, but there are other ways of helping you contend with your daily existence. And this is a great example of it in seeing Frida Kahlo with this, because when you are there for 3 months, I guess you do make it more like your home.
Correct.
Don't you? Try to do that as much as you can.
Cristina and I thank you, Bob Mackie. We've discussed this image quite a bit, Cristina, because first of all, Bob Mackie, there is a photographer in all these hospital photos that document Frida, I'm sorry. And this one is interesting because Frida is looking, we're so used to seeing her all dressed up and performing an identity with a lot of Mexican symbolism on them. These Oaxacan, these traditional Mexican attires. This one, she is revealing her prosthetic leg, which was a red boot that she even bedazzled with like a drawing of a dragon or something like that. No, Cristina? So she's revealing her prosthetic leg to the photographer. She's actually smoking. Her makeup is not done. Her hair is not done as she generally did. And then she's with her nurse, Judith, who she really was grateful for and developed a great relationship. And the pose looks very similar to one of those Pietà poses where we see like the Virgin Mary carrying her son Jesus, and so she created these images in the hospital, Bob Mackie. Again, not fair to put you on the spot, but is this possible today? Is this something that was unique to Frida and how he created an environment where she could thrive? Or is this something that is out of compassion of the healthcare providers that allow for all of these different activities to take place, in your opinion?
I would think that she was a special case in that sense, and this is clearly staged, right? This is somebody who's invited to come in and take those photos. Yes, we did have official photos, and you do see some of the examples of the hospital, of the staff all lined up. That's the more typical image you would take from the hospital, and of course today with the Health Information Portability and Privacy Act, HIPAA, that ain't going to happen now by and large. So, and there we go. That's there we go. Yes.
Thank you.
And hospice is another good example of a situation where we do want to make the hospital room, if you are an inpatient, or even if you're being taken care of at home, as homey as possible. Bring everything in that you can, and it's another important time in people's in lives as their medical course continues and finishes. That you want to provide that kind of environment. You get a little bit of that sense, perhaps, from Frida Kahlo's surroundings as well. Although she clearly, with those multiple hospitalizations and operations, she knew what it was like to come to hospital.
She knew what she needed, I guess. Cristina, what are your thoughts on this?
Well, I have a lot of thoughts on this photograph. First of all, the environment, what we have been talking about, smoking at the hospital, etc. Also, she doesn't look the way we used to know Frida Kahlo, with the ribbons and with the Mexican dresses and so. But more important is that, as you say, Monica, there was a photographer in the room. And this took me, since I saw this image, that about who in that circumstances would let journalist photographer to be into that room, And here we have to talk a little bit about Guillermo Kahlo, Frida's father, who was a photographer, a professional photographer. So Frida started to pose in front of the camera since she was a child, and we have some images of the childhood of Frida Kahlo in the exhibition. But so that was the first approach of Frida with photography. But later, when she married to Diego Rivera, they were a very uncommon couple of artists in Mexico. So all the journalists that came from outside Mexico, from the States or Europe or whatever, want to go to what we know today as the Blue House, where the museum is, and they want to take photos of Frida Kahlo. As I told you before, there are many, many photographs of Frida Kahlo. But I think that Frida knows the importance of photography as a document. And that's why she knew that all these photographs in the hospital where she doesn't look as beautiful as she used to look in other photographs, were equally important. These images are part of her biography, of her life, and she let the photographer to took those images. So I always do to myself that question: who in that circumstances will allow a photographer to take an image like that? Only if you know the importance of photography as a document. And Frida knows that.
Thank you, Cristina. I think yes. You were?
Please go ahead.
I would like to, if you don't mind, unless we want to, contribute other thoughts. Perhaps we want to hear from the audience. Cristina, would you be okay with that? See if we can.
Yes, of course.
We can get some questions. So I wanted to see, if we could get some questions or comments from the audience, and we can ask Cristina, and we can. Okay, let me go 1, 2, and 3. Yes, and I'm going to have to bring the microphone. No, because the questions are probably for you and Cristina. Yes. Okay. So Olivia, my colleague, is going to be passing the microphone, and we do need to speak into the microphone because that's the way that Cristina can listen to what we are saying. It was over here, and then over here. Yes.
Thank you, all three of you. Fantastic presentation. I was just wondering a couple of things. Given the importance of photography to Frida as a child and her father's role, and she brought this into the hospital, did she ever use photographs as a source of inspiration for her painting? And then also, given the fact that she did so much painting, because she had to, from her hospital bed, did that, it seemed to have obviously limited the canvas size that she was able to use, and did that sort of become her accustomed, preferred canvas size?
Thank you. Cristina, I'm going to let you take this one.
Yes, yes, that's an interesting question, because I have two things to tell you. The first one is that she used photography as an inspiration for the paintings. For example, for that painting that we saw of the family, that she was painting the family, not the other one, she used some of the family photographs to make the portraits. For that painting, but not only in this one. For example, she make portrait of Guillermo Kahlo, her father, which is a beautiful portrait, and it's at the Museo Frida Kahlo. It's one of the paintings still at the Museo Frida Kahlo, and she took for inspiration a photograph done by Guillermo Kahlo, which was a self-portrait. That was interesting also, because Guillermo Kahlo used to make a lot of self-portraits, Frida's father. And so when she started to paint, I think that the most important influence on Frida was Guillermo Kahlo, her father, because she saw the father doing self-portraits. So that's the way that this subject arrived to her creativity in a very natural way. Then the second answer I have at that point is that Frida herself tried to make photography. There are 3 photographs at the Museo Frida Kahlo, signed by Frida Kahlo as an author. So I think that she also, in some moment of her life, she tried to make some photographs, and maybe she was exploring if she can make photography in the same way that the father. But she leave photography and keep on painting. And the other, what ya me perdí?
The size of the canvas. How interesting.
About the size, No, Frida Kahlo, the only big paintings that we know she made, one is the Two Fridas, which is a very big painting. I don't know, it's about 2 meters by 2. And it's in Mexico City at the Museo of Arte Moderno in Mexico City. And the other one, it's a big painting, which was about 2.5 meters by 118 centimeters, and it's called La Mesa Herida. But that painting went to Russia for an exhibition, and the painting get lost. No one knows what happened to that painting. But those were the only 2 big ones that she made. She usually make a small format and even smaller than these ones.
Cristina,
I'm sorry. I don't think it has something to do with a hospital or lying in a bed. I think that she preferred that size of painting.
Because it's also nuanced work, right? It's they're not these big brush strokes, right? They're
like
tight,
Diego Rivera, for
work.
example. Diego Rivera made murals. That was, I think, they were different. And for the type of subjects that Frida worked, which are more intimate, small size is better than a big one. You have to get into the painting.
Cristina, was it with a conversation with you? Who were we talking to that said, it's so interesting that today it is Frida? Back in the day when Frida and Diego were the artists of Mexico City and the creme of the intellectuals in Mexico City, nobody back then would have ever envisioned that it is today Frida who is the most famous artist in Asia. And I believe in all Latin America, and I believe it's only in Australia and in Europe that Artemisa Gentileschi is as known as Frida, right? But nobody would ever imagine back then that this was a case today, that these digital immersive experiences are about Frida's work. And I think you mentioned that it is because her work can travel around the world. There's been several exhibitions on the work of Frida that has been able to circulate through the globe, as opposed to the work of Diego, which are murals that you actually have to go to Mexico City. You actually have to get permission to go into the presidential, building to see some of these murals, and that portability of her art has played a role in her being so renowned around the globe. Do you remember who we had this conversation with, so we can
well, that may be a point, but the most important point in why Frida Kahlo has become such an icon is because her life is as an open book, and I think that we also had this conversation that everybody feels linked to Frida Kahlo in some of her many issues in her life. If you have some kind of handicap, physical handicap, or if your husband has been unfaithful, or if you are unfaithful, or if you are an artist, if you are a feminist, there are many different ways to be linked to Frida Kahlo's life. But what is really interesting, talking about her art and talking about Diego Rivera, is that Diego Rivera was really a huge character in Mexico, not only because of his eyes, but because he was a very well-known artist and he was known everywhere. But the interesting point here is that even that they were married and they lived together and both were artists, Frida Kahlo keep her own personal expression, and Diego Rivera also. They are completely different voices in art, and I think that's something really that we have to highlight in Frida Kahlo, that she always keep her own personal expression.
Thank you, Cristina. We had another question here, Olivia, here at the center, second row, center. Thank you, Olivia.
Yes, hello. My question is, how different do you think Frida's art would have been if she wasn't as sick as she was?
Did you hear that, Cristina?
Yes, but I didn't understand the
Yeah.
last word.
¿Qué tan diferente hubiera sido el arte de Frida si no hubiera estado tan enferma?
Well, if she didn't have the accident, first of all, she will not be an artist. She wanted to be a doctor, as Robert. So if she didn't have the accident, first of all, her life will be very different. She maybe became a doctor and not an artist. First of all. And secondly, I think that if Frida didn't marry to Diego Rivera, also we will have had a different story.
Right. Thank you. We had another question over here. Thank you so much. And then we have a fourth one in the back. Thank you.
Thank you. I apologize for the morbid question, but Dr. Maki, so Frida in the end did die of osteomyelitis. It was uncontrolled osteomyelitis that unfortunately led to her demise.
My understanding is that it was actually a blood clot in the lungs, a pulmonary embolus that may have been associated with a pneumonia. But there was also some question of her becoming dependent on pain medication despite all the issues around the morphine or laudanum. I think there was some question of use or abuse later in her life, totally understandably, obviously.
Thank you. We have a question in the back.
Ante todo, Cristina, muchas gracias por su tiempo.
Gracias.
My question is, because after you explain about the photography, because if we really look at each one of the pictures, they're aesthetically pleasant. Like, that's me just looking at it. But now I'm trying to go back to when it comes to photography. You know, it's not like today. You take a picture, you look at it, and then you approve it. So I wonder if she got to approve these pictures to the public in order to be shown, because I'm sure, you know, she didn't get the chance to see what was being taken the moment that somebody was snapping a picture. So, yeah, that's my question.
¿Entendiste, Cristina?
Si ella pudo ver las fotografías y las autorizaba.
Exacto, que
es
si
la
ella pudo
pregunta.
ver el resultado final de porque evidentemente le tomaban las fotos, pero ella estaba posando. Entonces, si ella en algún momento tuvo la oportunidad de vetar o de aprobar algunas de estas imágenes.
Well, in the case of the last images from Raúl Anaya, the ones that Frida, these ones that were she was not this one, ese es anterior. The one at the hospital with the nurse and so on. I think at the exhibition we have about 3 or 4 of these images. I don't know exactly if she saw them or not. And but when you allowed someone to take the photograph, then the rights are from the photographer, not only from the person who posed on the photo. So. But she allowed that. So it's the same a little bit with letters. We have a lot of letters in the exhibition. And somebody asked me if that was not a little bit, ¿cómo se dice? Como intrometerse. I don't know how to say that in English, because it's like something confidential that you are showing to the public.
Invasive, no? Right? If we were not invading her privacy.
Yeah, but exactly. But in the case of Frida Kahlo, I think that she write a diary. She keep all these photographs. These are not at the Blue House, but many others are at the Blue House, and keep all the letters from lovers and so on and so on. And she knows all the time that her health was fragile, all the time. And I think that if you do not broke the things, is because you want somebody else to see them later. And that's the reason of this photograph, for example. She wanted to people to know that she was in a bed of a hospital and with a prosthesis and all the things, because if you see the image, she could be with ¿cómo se dice? Sábana?
The sheet.
The sheet covering the legs. But if you see, the legs are outside. That was on purpose. So what is interesting in photography and in this exhibition in particularly, we have to see the details. How can you imagine that posing for this photograph was, no? She was, maybe she told to the photographer, let me take away the sheet so the prosthesis can be seen in the photo, you know? Otherwise, you put the sheet and to cover that.
And the other leg, Cristina, shows Mexican embroidered textiles. Like she under the hospital gown, she was wearing a traditional Mexican attires, which is what we can see on the other leg. And it also the embroidery was red, which kind of like matched the color of the prosthetic leg.
Yeah, and that kind of embroidered is from the huicholes. And we have also a photograph which is here. And these are people from the huicholes, indigenous from Mexico, and they go to the hospital to visit her, to visit Frida. So that's another thing that we have to see in these photographs. Who goes to the hospital to see her? Friends and Diego Rivera, and so, but also these people who were related to Frida, and that maybe she buy the Mexican traditional embroidered that they make, and that's the case of the one that you were talking about, Monica.
Correct. Thank you. Yes, one more question.
Oh, thank you. I really appreciate this talk. I just went to Mexico last summer, and I've been in Frida's house for a few times, and I think she knew since she was a kid that her passion in life was beyond her own life. Because I remember seeing the pictures, and I think maybe you can talk a little bit more, when her passion became not just the art, but the passion for politics and a cause to help people. She knew that her life was small comparing to the passion of helping or fighting for her cause, whether it's art or politics. So I think it became like the same blending between her personal life, her political life, and her art, and one like a person that was very strong in character and very passionate about not just showing the suffering, and she could go beyond that suffering to show that there is more about art and politics and helping a cause than her own life.
Thank you. Cristina, you have any comments?
Yes, you are right, and that's part of the complex of Frida Kahlo's personality, because she was involved in many things, politics and art, and also Diego Rivera and Frida Kahlo were great collectors, art collectors, Mexican art crafts, popular art, and I think that the point in that is that Frida Kahlo loved Mexico. Even her father was German. Guillermo Kahlo also stays in Mexico. He arrived aged 20 years old, and he made a living in Mexico, and he married in Mexico and had daughters in Mexico and worked in Mexico. And I think that the family, really involved in everything that happens in Mexico. His people, art crafts, popular art, politics, everything.
Thank you, Cristina. I hope we can continue the conversation on April 1st. Cristina will be here on April 1st. We will have a members reception. So here, this is a great opportunity for many of you who have not become members to become members of the parish. Our colleague Cherie is your point person for that. Thank you, Cherie. So Cristina will be here to have a celebration, to have her in person, to continue asking her some questions, to continue the conversation with Cristina on April 1st, which will be a celebration for the museum's members at noon. And thank you, Cristina. We'll see you on April 1st. And thank you for visiting us back to conclude and close with a golden brooch. I don't know if we say that in English, but in Spanish, we close with a golden brooch, which will be April 1st. Thank you, Dr. Robert Mackey. We are so grateful for your expertise and for the insights you shared with us on the profession, and in particular on Frida's files. They illuminated a lot of...
Yes, thank you, Monica, and thank you, Robert, for being with us. It was really interesting to have all your comments. Thank you to both. And thank you, everybody, for being here.
Most importantly, thank you for attending our talk. I hope this is the first of many. And Cristina, thank you for designing this heartfelt exhibition with so layered, so nuanced, so rich in the human condition. And it's certainly a vehicle for understanding Frida and her art, and a tremendous contribution to the field of art. And we are incredibly honored, privileged, and grateful to you for allowing us to host this exhibition here at the parish. So our eternal gratitude goes to you. Cristina, we'll see you very soon. Thank you, everyone.
Bye-bye.
Thank you, Bob Mackey.